First of all, let me be very clear and be honest to my friends here that I don't belong to that group of journalists who do the regular health beats, but instead I was doing the regular shows, interviews in my channel, and my personal experience during the COVID days and in and out of the television box is what I would like to share here. The next important thing that I was just recalling an interview given by the legendary cricketer Kapil Dev once when a journalist asked him about his experience in the World Cup tour in England. He said, everything, so मौसम तो अच्छे थे, जगह तो अच्छे थे, लेकिन अंग्रेजी वो तो बड़े मुश्किल थे. So Kapil at that time was very poor in English. So he said most of the time he was silent. So I was just recalling that interview that if we were given a chance to speak in the mother tongue, we would have put everything in an effective way. But unfortunately, our friends from other states have to get informed. So don't look for any grammar when I speak because expressions need no grammar. Okay, let me come to the point. Now let me answer to your question, Ashim. As we all know, the world before and after COVID was different. Before COVID, when it comes to the way we work, the government had their way of doing things, media had their way, and the public had another way. That was the way things worked before COVID. But when the pandemic hit our state, I mean the whole world, things have changed. For the first time, I think there has never been a time before when people have so curiously looked for an information, either through the television sets or through YouTube or whatever sources they had. Because during the time of pandemic, an information is as vital as food and medicine. I think you all agree with that because there was a time when people were confused. There were a kind of panic situation everywhere. People were looking for every bit of information, either from the government sources or from what the media says about the veracity of the pandemic, how it is going to affect our life, what the world is going to, how it is going to change after the COVID, everything, and what drugs should be taken, what are the changes that should be brought to the lifestyle, and how we should get ourselves protected from being affected by COVID. I remember in those days, I was in constant contact with Dr. Ashim, who was then the director of the Social Security Mission. And he was giving, the government version of the whole thing. And whenever I put questions or criticism or like the critical kind of questions, he said, this is not the time for argument. So we are fighting a battle and we are fighting our battle to save the life of the millions. So my institution, I think my friends in the media and the media in general, we have taken a stand, a very bold and a very appreciable stand to stand affirmed by the government policies, the government informations, whatever the government is doing at that time. Actually, we had long, lengthy meetings, editorial meetings, discussing about the way how this COVID matters should be reported. Should we panic the general public by giving all the details, the death details of all so that was happening in and around our country? Or should we focus on the positive side of it, how we should battle, how we should, fight this pandemic? So we have decided to mix both. So we will give the death toll, everything on one side. At the same time, we will give an additional, affirmation or an additional force for all the information relating to, the positive side of the things. So there was an unusual briefing of the Chief Minister every day in our state. Putting before the public all the matter as such, what is happening in the state, how we should fight the battle, what all things we have to do. And the media as such, there had never been any critical questions on the government measures that has been taken. I think the opposition was completely supporting the government policies. But we had another big, a crisis when at the point of reporting, because there have been so much of false news, misinformations that have been spreading through social media, through WhatsApp and other social media platforms about the COVID. And that has really put the general public in a very panic situation. People were prescribing medicines. So I had an experience when I was affected with COVID and was taking rest in my home. Some of my doctor friends have given me some advice. So you should take this. So there was a you might be remembering that the coriander powder, then lemon, mix water. You should take it daily. You should develop the kind of immunity in your body. So I remember this was actually supplied in our office to all the staff every day. So you should take it as a precaution. I don't know how many of you have done that. Okay, so there was so many of, we didn't have a clear idea what to do and what not to do, what will be right and what will be wrong. So so that was the only time in my memory, maybe in your memories too, that the doctors advised their patient to stay at home. They never wanted patients in hospital. I hope you remember that time. So when you call a doctor and when you say that I have these kind of symptoms, the doctor will say, you stay there. Unless and until you have any, breath issues. So that was a common thing we all had. Then they will be admitted to the ICU. And the ICUs were full and there were no space left, no beds were left out. So that was the condition. And there is two parts for it. So one, the media fraternity as the community as a whole, how we handle the situation. The second is how the journalists handle it, as the madam rightly pointed out. So they were along with the guys from the health department and the medical doctors, we were also the front runners, front fighters in the field. So we were directly in contact. We were exposed to all the harmful atmosphere during the time of COVID. All the journalists. So yesterday during the inaugural session, I think Justice here he pointed out here it was exemplary from the part of the Kerala. I mean the journalists as a whole during their work during the time of COVID. So two important issues we really faced. One is how to battle the spread of misinformation. That was the one thing. And the second one, how we have to keep ourselves safe while we were reporting the COVID from the field. So you were talking about the break the chain. So actually we did that advocacy part of that whole thing. The break the chain was all the medias carried that break the chain campaign. So it was widely.
The government campaign carried out free of cost.
Free of cost, yeah. It was carried free of cost, and so when it comes to the to television, so the whole airtime was dedicated exclusively for this. So where there will be a COVID update. So whatever news was given on the screen, there will be a COVID update. There will be a break the chain campaign, and all the familiar face in the television, they were acted on that. So break the chain. Let's break the chain. That was the campaign, and we gave all the support to them. So I remember, so we were working late at the night during those times when people were forced to sit at home. So I still remember the way when I was traveling back home from the office, sometimes late in the evening or late night. So it was just a fearful sight because nobody is in the road. It was like a deserted road. Nobody there, no shops, no people. So it really it's a very fearful thing when we think of that. So we had all gone through that as journalists, whether you are a journalist, whether you are a doctor, or whether you are doing whatever you are doing, we have all had the similar experience. But for the journalists, we had that critical issue that how to give this information, how it should be imparted to the public, how cautious we should be. So we have done our part. So it has given us so many lessons. The one best lesson is that it has given us a strength for the preparedness. How we should get prepared for if there comes another pandemic. We know now how to deal with the matter. No, we have so many examples. We have so many experiences. I think all this will go beneficial in the future also. And Dr. Achil, the second part we have asked that my concerns that we will discuss later.
Before I would like to flag your concerns here itself, because when the answers comes, then actually it will be spicing up the discussions also. So with the permission of the other panelists, we can actually, so that would literally spice up the discussions.
I was thinking why Kerala, see our state, unfortunately or fortunately, it is one of the states in this nation that has reported the first first cases of many viral diseases. It's fortunate or unfortunate. So, for example, COVID and Nipah, we have monkeypox, we had dengue, we had Japanese encephalitis, everything is reported here. So, again, I have a question for the doctors also. What exactly is the reason why our state is so much prone to these infectious diseases? So, ours is a very small state, very few, I know, it's a very, very small state here. We are in a secluded state. Still, we have the highest number of cases reported here.
That's a concern number one.
Yeah, one concern. Then, so being a journalist, my primary duty is to voice the concerns of the public. It's about the post-COVID issues that we are facing. So the so-called unnatural death that is being reported in the case of young men and women here. So it has been associated with, with the, so somebody says it is the after effect of the COVID vaccination. That is what this cardiac arrest deaths that we are witnessing now. I don't know how far this is right. Again, I was reading a report that was published during the COVID days. In such a report, it was saying that researchers are finding out that some of the medications that are being used to treat COVID-19 may be leaving patients at increased risk of sudden cardiac deaths. For example, medications such as hydrochloroquine, which was considered as a wonder drug during that time. So people were running after whether there is enough doses of hydrochloroquine in the hospital. That was the first question we were asked during those times. So medications such as hydrochloroquine, lopinavir and ritonavir, which are being used off-label for compassionate use, may cause drug-induced issues. So I would like to get a clarification on that from our doctors. And recently we have a report from the Ministry of Health and Family Welfare saying that lifestyle and pre-existing conditions are identified as key factors for these sudden deaths. So it was posted on 2nd July 2025. It says there is no direct link between COVID-19 vaccination and the reports of sudden deaths in the country. Dr. Ashil, I would like to ask you one question, whether there has been a proper study on this, because the AIIMS, All India Institute of Medical Sciences and ICMR are still continuing the research on this, whether there has been any side effects for this COVID vaccination. Because during the time when we were asked to administer the COVID vaccination, we were told that the government of India had made it mandatory. So we were told that vaccination, to produce a vaccine, we need years and years. But we did it in a very short time. And we were told, the general public were told that you have to take it for your safety. So is it that why the medical community is still silent when these unnatural deaths are happening around us? So I would like to get a clarification on these things. Thank you.